So Dr. Sue Peter is an educational psychologist who spent a lot of her career helping young people with all sorts of struggles to integrate into the school environment. You yourself have experienced long COVID and also supported your own daughter, I believe, with the condition, and you're now working with the charity Long COVID Kids to try and make an impact in supporting young people who are struggling. So
exactly.
Thank you so much.
That's right. Thank you very much. It's lovely to be here. So just to reiterate a couple of bits there, I'm talking today as an educational psychologist with the charity Long COVID Kids. I also work as a local authority educational psychologist for the other part of my week. I have long COVID myself, and also I'm going to be speaking as a parent of a child, a 16-year-old with long COVID. And also just for full transparency, my daughter is seeing a cardiologist who is in this room. So just So I've been asked to talk about the bits that you can see up there. So quite a big brief. I only have 15 minutes. I could probably talk for 15 minutes minimum about each of these. So please bear with me. It's going to be a little bit of a whistle-stop tour as I go through. So thinking first then about sort of prevalence and symptoms in children. We heard a little bit about this already from Leslie earlier on in terms of the school infection survey. So the bit on the right there at the top, nearly 1 in 50 primary school children, nearly 1 in 20 secondary school children are experiencing long COVID since their most recent infection. And just in terms of those secondary figures, if you've got a secondary school of around 1,000 pupils, that's potentially 48 pupils in that school, which is quite a big number. And then on the other side, we have the ONS figures. I should say both of these published this month, last month, June, but relating to figures in March and April. So you can see there 115,000 children and young people now living with long COVID, 90,000 of those for at least 3 months, 26,000 suffering symptoms beyond 12 months. And if you compare the month by month figures, that's gone up 3,000 in the last month. And 16,000 of those have their activity limited a lot. Oh, and I didn't say about gender. The Fair Health white paper there from May 22 shows that in all the age ranges between 13 and 50, more females infected with prevalence sort of 60% plus, apart from the 0 to 12 age range, where it's much more even. So males 50.5% to females 49.5%. So just a slide really on symptoms in children. So lots of similarities with adults, but these are the top 10 symptoms that the CDC in America has highlighted, particularly in children. I'm not going to read them all out, but you can see them there. And we often talk about it, long COVID in children being the elephant in the room. So there's a little symptom picture that long COVID kids have created. And again, similar to what we've heard already from Toby Hillman, multi-systemic, you can see the picture there. And again, much like in adults, symptoms really vary by individual, affect all systems. They can either continue on from the initial infection, or they can develop weeks or months after an apparent recovery. Symptoms can be continuous, so felt every day, or they can come and go in kind of a relapse and remittance pattern. And again, like adults, the duration of symptoms is unclear. There are some children in the long COVID kids groups that are still ill since infection right at the beginning of the pandemic in early 2020. And again, like adults, children can develop these other conditions, so POTS, PANS, PANDAS, PIMS, ME, CFS, and MCAS type symptoms as well. So what does this mean for children and young people? I think the first word that I want to pick out is unexpected. And I think the difference between children and adults and long COVID is that for children, the narrative has been right from the beginning, children don't get COVID, they don't transmit COVID, they only get COVID mildly, they don't get long COVID. So when your child does get long COVID, it's actually quite an unexpected, I think the right word, something that kind of hits you. It's like, oh, I didn't even know this was possible. And still, even now, I hear all the time, well, children don't get long COVID, do they? So the unexpected, I think, is a really big thing for children. Again, like adults, a long-term debilitating health challenge, which can impact your ability to access daily life, education. And access to healthcare is really variable. In the support groups, there are stories of people getting fantastic support. There are stories of families really getting very little, experiencing minimizing of symptoms, gaslighting, and a real lack of knowledge. That goes back to that first point about not really understanding that long COVID can affect children as well. And then, like with adults, no treatments yet for long COVID. So there are some long COVID clinics for children, but they are mainly supporting children to live with and manage their symptoms. And then again, alongside those physical challenges, we've got the uncertainty of future recovery, and that can have an impact on mental health. But again, I want to be clear, with the minimising that has taken place, many families have experienced, it's just, it's your child being anxious, or it's a mental health condition. So actually, when we do see mental health needs, they're often as a result of the long COVID and not instead of it. And then in terms of schools, just likewise with healthcare, many families are reporting a lack of understanding from schools. And particularly at the moment, schools are being really directed very heavily to focus on attendance. So there's a real conflict there. So I'm just going to take another big gulp of water. So this is just a little bit about my family's experience. So this is my daughter, and you can see on the right-hand side, very fit and healthy. She did sports 6 times a week, probably. She played squash at a county and regional level, played football, did athletics, sprinting, long jump, as you can see there. As I say, no underlying health conditions. As a family, we all contracted COVID in January 21. None of us were ill enough to go to hospital, and it was before any of us were vaccinated, and we had the kind of typical symptoms. My husband and I lost our smell and taste, but the children didn't. And then post-COVID for my daughter, those symptoms just continued. Actually, the rest of us started to feel a bit better. Our fevers were going down. We started to, think we're coming out of this, whereas hers just kind of kept going, and then new symptoms began to emerge. So she experienced the feeling of tight chest, of having a tight chest, heart palpitations, the fast heart rate, the dizziness, and the extreme fatigue. So I should say I've noticed there's a lot of GPs in the room. Our GPs have been fantastic. Sent us to A&E early February. They did a few tests there and then just sent home. She's probably just anxious. So as a mother, as a psychologist, I knew she wasn't just anxious, and I knew there was something a bit more physical. But we were told to see how she was and to go back to the GPs in a couple of weeks if she wasn't better, which we did. Back to the GP, back to A&E, and then admitted to the children's wards for some further tests, which they did. They told us it was myocarditis, but again, not entirely sure based on what I've heard today. They discharged her after 2 days of tests and said that she would have a follow-up in a few months, which turned out to be, I think, 8 months, which for a child who's very fit and healthy, suddenly you've had myocarditis. It was a very difficult time of waiting and not really knowing anything about long COVID in children at that point. So since then, she's been diagnosed with long COVID. She's been diagnosed with ME/CFS. She's undergoing some tests for autonomic dysfunction, and she has chronic daily migraines. So all those symptoms are still there. The only treatments really that she's having at the minute are acceptance and commitment therapy from a clinical psychologist, doing some activity management with a physio, and she's having some vitamin supplements, additional salt, and drinking lots of water. So she probably has had puppy therapy as well, as you can see by the pictures there. New puppy over this period of time. So in terms of access to healthcare, it was a really long wait, as I said, to see the NHS paediatrician or cardiologist. And in the end, we decided to go private and were able to speed up those appointments. But the NHS paediatrician, actually, the first 3 appointments we had were 3 different paediatricians. So just quite difficult in terms of continuity of telling your story and feeling that you were being held and that things were moving in the right direction. Physiotherapy has been amazing. She's been probably the one constant from fairly early on and still through now. And she's focusing on a program of tasting and activity management. And now my daughter's exams are finished, we're hoping to do, she's hoping to do some Pilates with her, I think. She has been seen at the long COVID paediatric clinic. That was an 11-month wait. So again, about a long period of time before we got there. Great in that it was multidisciplinary. For the first time, we felt really heard, really understood. There were professionals who really did know about long COVID and children for the first time. But it's very much seemed like a one-off. So although we've had referrals on, there hasn't really been a process for review so far, and I don't know whether there will be. And then, as I say, we went down our own private route. So initially saw a paediatric cardiologist who said there was some autonomic dysfunction. She did trial a range of medication, but it didn't really have an impact on her symptoms. So she's been referred to an adult cardiologist, and we're just in the process now. We've been referred to lots of other professionals. She's had a lot of tests. She's had a tilt table test, all the whole kind of range of tests, and we're now due to go back and see the cardiologist in August. So we shall see where we get to with that. No pressure. And then just a bit about impact of daily life and family. So long COVID has had a huge impact on my daughter's life and on our family. In terms of school, she's on a reduced timetable, so she was doing 3 half days and 2 full days every week. She was driven there and back. She would normally walk, about half an hour walk. She would normally have walked that, no problem, but needs to be literally dropped to the door. Even with that timetable, some days she's physically unable to attend school at all. Her attendance has really dropped. It was nearer 60% now. And the middle picture was last summer. So she gets home from school, she's brought home in the car, and then she usually sleeps for 2 to 3 hours every evening. So that then has an impact on homework, coursework. She just wouldn't have the energy to do anything else that day if she'd been to school. And then it also, in terms of school, missing out on things like Duke of Edinburgh, field trips that are really related to her coursework and her GCSEs. And they're missing out, obviously, on seeing friends and social activities. And I think the big thing for her, given her identity as quite a sportswoman, is just really not being able to return to that level of fitness. So walking to the end of the road, walking up the stairs is a big deal. And then just thinking about the impact on the rest of our family, my son, thinking about holidays and family activities, we have to do a lot more planning. We're planning, where can we park? How far will she need to walk? Where can she sit down? And even planning things like what we're doing the day before to make sure she's rested enough to do an activity. What will we do the next day so that she can recover? So a big impact. I could talk forever on this subject, but I won't. I will direct you to the blog that I have written. The link is at the bottom there, and I think you're getting a copy of the slides. So we asked the children via their parents in the long COVID Facebook group to describe their long COVID, and also to describe in more detail the symptoms of long COVID and how that made them feel. The graphic there is their general descriptions of long COVID. So you can see some of the words there standing out: tiring, exhausting, sad, painful, lonely. And a bit like Anita was saying, the things that they really wanted their teachers to know and other professionals to know is that they wanted to be listened to, they wanted to be believed, they wanted to feel understood, they wanted to be asked what would help them, and they wanted to be supported, to be able to engage with their education, their learning, to interact, socialise, and with their mental health and emotional well-being. So just thinking about returning to school and support once in school, it's really important to initially be able to focus on well-being over attendance. And Long COVID Kids has an OT that they work with really closely as part of the charity work. And she's devised these 2 posters you can see, and there's also blogs that go alongside them, and they are really focused on pacing and energy preservation. So the cautious tortoise is like a flow chart that you can use to think about returning to different levels of activity, and the penguins is guidance on pacing, which is written in a way that children can also understand. And then once they're able to return to school. Just thinking really that, just as we've heard that long COVID is so individualised, so does the support that needs to be in place. Every child will have different needs, and so therefore they will need quite a flexible, individualised approach in the classroom. So thinking primarily about their access to education and their inclusion. There are a lot of children in our long COVID support group who are unable to access any education. There are some who are only accessing part of their education, and thinking about the wider impact of that. Alongside thinking about the impact of their symptoms on their learning, the homework, exams, obviously we've just had exam season, and also thinking about the missed learning that they've had when they've been too ill to attend school, when they've been out for medical appointments. And then also thinking about the impact of their symptoms on their well-being, so thinking about anxiety, isolation, self-esteem, belonging, and friendships as well. And the link at the bottom there, I will talk about it a little bit more in a minute. That links to our the Kids support guide, which I will come back to in a second. But there's lots more information about support in school in there. So in the classroom, just a couple of things you might see. The headings relate to the SEN code of practice. So in terms of communication and interaction, it might be difficulties expressing themselves and finding words when they're feeling tired, when they have the kind of cognitive dysfunction, when they don't understand, if they've missed learning, or if they're feeling anxious about gaps in their learning. In terms of cognition and learning, again, the fatigue I've mentioned, leading to difficulties with concentration, memory, brain fog and headaches. And gaps in learning, again, like I've said, due to missed school, reduced attendance, or even like regression in skills, like you might see in children with PANS, PANDAS. And then in the social, emotional, mental health side of things, thinking about anxiety that might be caused by the duration of the symptoms, the severity of their symptoms, not feeling understood, missing school, missing out on social activities, which might lead to social isolation, a lack of school belonging. If you're out of school so much, you don't really feel that sense of being part of something, and also a loss of identity and changes to sense of self if they've had to change their hobbies or feel that their life is really quite different to how it was before. And then the physical and sensory. So sensory might be sensitivities to noise and light. We're hearing more visual difficulties, and also distortions of smell and taste. And then the physical symptoms that are very common in long COVID that might be impacting within a classroom, like chest pain, palpitations, the muscle pains, the stomach, gastro difficulties, fevers, and so on. Okay, so this kind of links really nicely back to what children told us that they would like adults to know, but specifically in the classroom, or if you're working with educators or working with children, again, it's about listening and believing them, their families as well, thinking about the impact on all aspects of their daily life and their wider family, asking them what would help them and how they would like to be supported. Think about the focus it might need initially to be on getting better and well-being before attendance and learning, and that kind of multi-agency liaison, multi-agency approach, so that any involved professionals and medical professionals are working together to support the child. So just to finish, I've just got a couple of references, and I want to tell you a couple of bits about the charity. So Long COVID Kids was formed in 2021, the first UK-based international charity for families, children and young people living with long COVID. And it mainly focuses on recognition, support and recovery. The purpose and the mission are there in the slides. And it's also been recognised by the NHS and the CDC, as well as being recommended in the new NICE long COVID guidelines. Okay, so actually I'm going to do this slide first. So on the website, we've got the support guide that I mentioned. This is a printed version, but you can register and download a copy for free. It's been created by parents and professionals. So Leslie's written a section on POTS that's in there, and it's been endorsed by lots of paediatricians and other medical professionals as well. It's got OT input, it's had educational psychology input, lots of evidence-based resources, lots of information for supporting children, their families, and school staff and health and social care professionals as well. So the link is there, it's free to download. The details of the website are there. Also on the website are lots of different blogs that have been written by different professionals, different parents, covering a wide range of topics. So lots of interesting information there. In the support guide, in the download, there are links to 5 Padlets. If you've not come across Padlets before, they're like an interactive kind of scrapbook. So we've saved lots of different information, articles, research papers, anything that we've found that might be useful and relevant to the different groups. There are 5 different ones there. And in terms of support services, if you are able to signpost any of your patients or their families, there's a very active Facebook support group for peer support for parents. LCK Connected are like Zoom Hangouts, so there's sessions for parents, again, peer support, but also sessions for children that are grouped by different age group, and different children attend and do different activities and talk to each other, and also Chatbox, which is like an online forum for discussion. Done that one. And yeah, just a couple of references there. That's again the reference to the blog I mentioned about how children describe their long COVID, and then a couple of articles I've written for education publications about supporting school. So thank you very much. That's it.
So the bad news, folks, is that the van delivering lunch broke down and is delayed by 10 minutes. The good news is, I know there are already loads of questions for you, so we will have a bit more time than we were anticipating. Yes, so any from the floor?
I wonder if we wanted to come back to the point that you made around being able to access and get those kind of the help you said. I'm also working as a paediatric physio, and these